Meconium Aspiration syndrome, the definition and the overview. This is the respiratory condition in the newborn caused by the aspiration of the meconium stained amniotic fluid into the lungs. It leads to the airway obstruction, chemical pneumonitis, and the potential pulmonary hypertension. And the pathophysiology is the first one is the airway obstruction. Meconium blocks the small airways, causing the atherosclerosis or the air trapping. Chemical pneumonitis. Meconium triggers the inflammation and the surfactant dysfunction, leading to the impaired gas exchange. Third one is the pulmonary hypertension. Hypoxia and acidosis contribute to the persistent pulmonary hypertension of the newborn. The risk factors like the post-time delivery greater than 41 weeks, fetal distress, example hypoxia, umbilical cord compression, meconium stained amniotic fluid, and the low APGS scores at the birth. Clinical features: respiratory distress, tachypnea, grunting, nasal flaring, intercostal retractions, cyanosis or the hypoxia, coarse breath sounds on the auscultation, barrel-shaped chest due to the air trapping. For the diagnosis, the history and examination: meconium stained amniotic fluid at birth, symptoms of the respiratory distress shortly after the delivery. For imaging, chest X-ray, patchy infiltrates, hyperinflation or the atherosclerosis, atrial blood gas (ABG), hypoxemia, respiratory acidosis or the mixed acidosis. For the echocardiography, evaluate for the PPHN. If suspected, management and immediate care will be the suctioning. Routine suctioning of the airway is no longer recommended for the vigorous infants. For non-vigorous infants with the MSAF, intubation and the suctioning of the trachea may be considered. For the supportive care, oxygen therapy, maintain SpO2 90 to 95%, mechanical ventilation or the CPAP. For the severe respiratory distress, surfactant therapy. This improves the lung compliance in severe cases. For nitric oxide, reduces the pulmonary hypertension. Advanced intervention, extracorporeal membrane oxygenation for the refractory hypoxemia. Monitoring and the prevention. Monitor the blood gases, chest X-ray on the oxygenation status. Prevent the fetal distress by the careful interpartum monitoring and timely delivery. Complication: persistent pulmonary hypertension of the newborn, pneumothorax due to the air trapping, chronic lung disease or the bronchopulmonary dysplasia, neurological deficit from the severe hypoxia. Meconium aspiration syndrome. This occurs when the newborn aspirates meconium stained amniotic fluid, common in the postpartum infant and those experiencing the fetal distress. Causes: airway obstruction, chemical pneumonitis, and the pulmonary hypertension. Symptoms include respiratory distress, cyanosis, and the coarse breath sound. Diagnosis is based on the history of meconium aspiration syndrome, clinical findings and the chest X-ray, patchy infiltrates and the hyperinflation, routine sectioning of the airway. This is not recommended for the vigorous infant. Management include oxygen therapy, mechanical ventilation, and in severe cases, surfactant and the nitric oxide. This is a major complication, managed with oxygen and if necessary, ECMO. Prevent by monitoring the fetal well-being and managing the intrapartum events. Long-term complications may include chronic lung disease and the neurological deficit.